we conduct on every Tuesday from the 8 to 9 p.m. So I welcome you all in this roundtable discussion, and very thankful that today with us Dr. Prakash Salami sir has joined, and I hope that several experts on this field have also joined today's session. So we all know that nowadays the AI is becoming the very popular in education these days. So this topic is on the use of the AI or the emerging role of AI in the modern microbiology. So in this critical situation, means particularly in the antibiotic resistance mechanism, we know that AI has emerged a powerful tool to support the researchers and the healthcare professionals in understanding and managing the AMR. So as far I know that the most important application of AI is the prediction of the antimicrobial resistance. So we use the different AI algorithms that can analyze the large genomic data set of the bacteria and identify the genetic mutations that are responsible for the resistance. Okay? And also we use the different the machine learning models that can predict whether a pathogen will be resistant to the particular antibiotic even means before the laboratory testing is completed. And the another major application of AI, we can say in the drug discovery, the traditional antibiotic discovery is time consuming and expensive. So by using the AI tools and the machine learning, okay, we can screen the thousands of the compounds within the minutes by using the AI tools. And also it may play a role in the surveillance and the monitoring of AMR. Okay. AI can assist also in our diagnostic in the clinical microbiology, predicting the outbreak and the transmission patterns. Okay. So now we can say that anti-artificial intelligence has the great potential to transform not only the clinical microbiology but also the all the all fields of the microbiology. So now, with this note, I would like to request all the present participants and the experts to share the research insights or any knowledge or any information on or their research experience on the emerging role of AI in the modern microbiology. So now the dais is open for the discussion. So I request everyone just please unmute yourself, first introduce, and you may share your research experience, research insights, or any knowledge or information on this particular topic. Because the objective of our roundtable discussion so that we can share our knowledge and the research
एवढे मार्क
experience.
कशाला पाठवले का?
So the most of the students or the
म्हटलं आपण
research
पहिले विचारलं नाही ना प्लॉट त्यावर जाईल ते.
get benefit from this one. So please, I request everyone to
डॉलरच्या वाढण्यामुळे झालं सगळं.
participate in this roundtable discussion. Hello.
Yeah, you go ahead. You can call one by one also.
Sir, Bajat Sheikh.
They can at least
introduce yourself. Okay.
No, they can introduce themselves and at least tell in what context this today's roundtable discussion can be useful for them.
Wajat Sheikh. Anshul Kumar.
Good evening, sir.
Good evening.
Am I audible, sir?
Yes, you are audible. Fine, audible.
Actually, sir, I am doing my PhD in medical microbiology from Rayarbera University, Mohali, Chandigarh. And sir, my thesis topic is on antimicrobial resistance pattern in blood culture isolates in ICU patients. So I wanted to know, sir, how to prepare synopsis and these publications using the AI techniques, and which is the best AI, because when I go to the YouTube and other websites, there are so many like Consensus, Jenny, and Quillbot. So it is quite confusing for me to decide which is the best AI app for better to go for this.
Means for writing your thesis?
For synopsis preparation also, sir, and for thesis also. First of all, I have to present my synopsis. Then afterwards.
Okay.
Hello.
So we'll discuss it, okay?
Yes, sir. Yes, sir.
We will take that question at the end,
Yeah.
the last one.
Yes, sir.
So you please stay with us till then and keep your question also reserved.
Right, sir. Right, sir.
But if you have done any work related to AI, you can always explain us.
Sir, I am not very much familiar with the AI, but usually I go for this Zotero and Mendeley for citation work. I use sometimes. Hello,
And what you do with that?
sir. For citation work, I use it.
Uh,
Mendeley and Zotero.
yeah, that is just like EndNote, right?
Yes, sir. But
Yeah.
sir, for currently I am reviewing articles, journal articles for my synopsis topic. One more this question is that from my side, how many research journals should I go or read it before finalizing my synopsis work?
8 बजेगा वहाँ पे वो
Hello,
डिनर विनर करके आवा है सब
hello.
Yes, yes, you are audible.
How to, sir? How much minimum research article?
यार होगा ट्यूशन में चले जाइयो हम इंगे तो गाड़ी लेके आवांगे बात कर लो सारा
People has to mute first actually.
Yes, you are audible, Anshu.
How many research article, minimum research article should I go for to write my synopsis minimum, and till how many years, sir, should, because for many years it has been going to work, some maybe 20-30 years before also some work may be going on. So recent, how much article till which dates I should go for, and how many articles should I study, sir? Hello.
So we will discuss it at the last. Okay. First, we will discuss on the particular topic, means
Yes,
the
sir.
emerging AI in the modern microbiology. Then we will take your question.
Okay, sir. Got it, sir. Yes, sir.
So the Anjali, Anusha,
Hello.
Asha. Yes, yes. Dr.
Hello,
Rasik.
Dr. Rashika Siddiqui here.
Yes, ma'am.
Sir, actually, we know the things which are being used in research. Like we have consensus, we have Literfy for review articles, we have Paperpal, we have Cloud AI. But in actual, what AI is nowadays used in microbiology, for that reason, I joined this roundtable
Thank you.
uh, meeting. So, whatever is being used right now in the industry, that we want to know actually.
Okay.
So there are some metagenomic softwares, AIs are there, they're used. For example, earlier we used to use Chrome for getting whatever the sequence which is being generated through NGS and all, whether that is pure or not. Chrome is used. So there are maybe alternate AIs are there. So that
Yes,
I
we
want to
will.
know.
Yes, yes, Dr. Rasika.
Okay.
I understand your question. Okay.
Okay, sir.
Now the deep.
Dr. Rishika has some experience, or if she has used already AI tools, she can always explain to the audience. So that will be actually useful. Because for this session, everyone is new. Is
Sir,
it
actually,
not,
right
Dr.
now I don't know what AIs are being used nowadays in actual purpose. But for review and research writing, I know the some of the AI which are being used.
Yeah, even that information is also new for us. So you can still explain or tell your views, how you used it,
Sir, at the end of the
how it
session, I
was
will.
useful.
Okay.
You can. Okay.
Hello. Sir, see, there is a workflow of using AI in the research. whenever we are doing a research, we have to find out what are the research gaps in our existing problem. Hello.
Yes, we can hear you.
So for gap finding, we can go through any of the AI, like even the chat GPT can tell you the gap, but nowadays Claude is being used. And for collecting the references and making the citations, consensus or paper pal is there. For review write-up, there is a paid version of some Literify is there, which will review the papers for the given last 10 years, 20 years. See, for the basic strategy, we have to go for 20 years ago. But for the gap, we have to find out the gap within the 10-year of the span. So likewise, many of the softwares are there, like softwares, not softwares, AI tools are there. For notebook LM is there for generating your PPTs, infographics, whatever you used virtually to convince the students. So this is my experience regarding the research tool which are generated or which are through AI.
Hello, ma'am. How we find the research gap? How?
For finding out the research gap, you have to study at least 10 to 20 years literature, whatever available on that particular problem. First of all, you have to find out the problem on what, uh, in which area you want to work. And then the 10-20 year research, you have to go thoroughly. Don't bother about the journals, but you have to go thoroughly whatever the research has been carried out in that particular field. Then you will come to know what are the research gaps are there. So if you use Claude AI, it will find the papers on a particular subject, on a particular topic, and it will give you what are the research gaps in particular area.
We directly use the cloud AI and
See, for collecting references, we use Google. We use the hard copies of the journal. Likewise, that Claude AI will give you the papers, authentic papers, not the fake one, not the fake one. Okay. So one by one, you have to go through paper, but that work will be done by AI. If you go through consensus, if you go through Literify, they will give you the existing papers on your topic. Sorry, not audible.
Some of the audience has to mute actually because their mic is on, so that is actually disturbing the conversation.
Yes, that is not right.
Yes.
Somewhere noise is there.
Vipransh, if you have some provision to mute all the people.
Mute them, sir.
Because Dr. Rashika was giving a quite useful information, and the more relevant directly with relation to her research activity. So it is more convincing actually. You please continue.
Oh, yeah. Okay. Someone in the chat box asked me asked in general which AI to use for literature review. See, consensus you can use. You can even feed there for what year you want the data, 10 years data, 20 years data. Consensus will directly give you, paper pal will directly give you 10 years, 20 years research papers, research articles, review articles on a particular topic. Okay. So you can use that. Red Rabbit is there. Many of the AI tools are there. Even Claude will do. But don't use the chat GPT for your literature review or anything.
Very useful suggestion.
So you can use consensus, or you can use a Litify app is there, AI app is there. It will generate you the outline for your synopsis. So according to that outline, you can go through the papers. It will give you the cross-reference papers also, research articles, review articles. You can go through the paper, or it will give you the summary of that paper also. You can chat with the PDF also by using these AI tools. Means not necessary. We don't need to read whole 20 or 50 pages paper. But whatever the crisp of that paper
Ma'am,
is that
please provide the best AI tool for review of literature.
best, you can use consensus or you can use the Litify for review of literature.
Okay, ma'am. Thank you.
Okay. So if anyone in real working with the AI in the practical field, I want to know that knowledge.
Madam, today you are only the expert for this roundtable discussion.
No, sir, it's not like that.
First of all, this discussion itself is a roundtable, means all are equal.
Yes, yes,
Within that,
yes,
at
sir.
least you have some sort of a practical knowledge, because we are
Yes,
seeing few things done from the student, and they are using AI tool, and then when we are actually giving for approval, now we have actually, beside plagiarism check, we have actually AI authentication also.
yes. So
Actually,
AI use of AI is not
no, but it should not be
like
used when
first
they
of all,
presented as such.
but using the as it is. Yes. So you
Yes,
cannot
it should
use
not
the
be used
AI
as
generated. Yes, you
data,
cannot use that
intact data. No,
because that language doesn't. Yes, huh. For the data collection, like we used to use when we are doing the we were doing the PhD 10 years before. We have to collect the hard copies of the paper. We have to read through the lines. We have to mark the lines. So that laborious task is being simplified using AI, but you have to use your intelligence, artificial intelligence for the laborious tasks, but for the creativity, you have to use your own intelligence.
exactly as rightly you told, during our time, literature collection
Yes,
was on the postcard type of the small no, card.
exactly.
Where
We have to go through like internet cafes, then the different libraries. So nowadays, students they have everything on the tip of their um, finger, so they can use that in ethical manner.
very good, very rightly you said.
Yes.
We can see some other expert. Otherwise, we will come back to you only at least.
Okay, okay. So,
You are from which university, by the way?
I am from BAMU University. Right now, I am working in KSK College, Bid, as
Bede.
a research guide and as a assistant professor.
Very good.
Hello, ma'am. I have a question.
Yes,
Hello.
yes. You are audible.
Yes, yes. When I am writing the thesis paper, you have said that we have to follow 10 to 20 years research papers. Okay.
Okay.
So while I'm writing the research paper, my thesis paper, so when I have to follow the methodology, so which
Okay.
methodology should I follow?
The
In
recent one.
some recent one. Okay.
Yes, the recent one. See,
Ma'am,
gram
recent
staining
means within.
technique.
Hmm.
Gram staining technique. You don't have any other option. You
No.
have to use that.
Yes, ma'am.
Yes, that 18th century wala technique only.
Uh-huh.
But whatever the other techniques are there, say for example, if you
Hmm.
are going to find out antibiotic resistance, so you
Hmm.
don't need to go that uh, plate assay and all. There are
Hmm.
chips available.
Hmm.
So antibiotic assay, antibiotic resistance, that will be easy with the discs, right?
Okay, ma'am. But I have a
uh,
question, ma'am.
yes.
Few papers, when I'm reading the new research papers, when
Okay.
I am following the methodologies, some
Okay.
research papers have different methodology and others paper have different methodologies. So what should I conclude from that?
See, ultimately, whatever suitable for you, whatever the authentic paper is there. See, what happens nowadays, publications, they are in tremendous amount, and every publication is not having uh, true research values. Okay, so that you have to sort out depending upon their indexing, and then whatever the methodology is feasible for you, you can go through that methodology. No one will object why you have used 20 years before whatever technique is there. If you have no choice in recent year, you can adopt the uh, earlier
10
methodology
years
also.
later. Okay, ma'am.
Yeah.
Thank you.
If you have any question, we put in the chat box also. So now, Anshul, Asha Chaube, Bharat
Hello,
ji.
hello.
Yes,
Good evening, everyone.
good evening.
So, I'm working as chief scientist in CSR Indian Institute of Integrative Medicine.
It's great, madam.
Yeah. So, we have the experience of working in bioprocess development and all, and traditionally, to develop any bioprocess is a tedious task of several years, right? And the AI has included some of the methodologies where we can reduce that parameters, or they can predict the parameters which are going to be like successful. So it reduces the time of process development. And in the area of drug discovery also, the studying the genomics and metabolomics using the AI tools can be beneficial to reduce the time for the entire process. Although I am not the expert in this area, but yes, I want to hear from some of the experts who are expert in the area of AI, how we can use the techniques for the process development. So that is why I was interested to attend this particular discussion.
Thank
So
you,
may
madam.
I ask one thing?
Yeah, please.
Yes, madam.
I want to add something.
Yeah.
Actually, ma'am, we are already having some softwares where we
Right.
can predict the whatever earlier used as one variable at a time approach, which is time consuming, laborious. But nowadays, like when I has done my PhD, we have used some parameters, or we have used some softwares for bioprocess optimization. We have used statistic softwares, Minitab, Statistica, likewise for the prediction
but
and
but they are not
certifying.
AI driven,
Yes,
no? So
exactly. Yes.
they are
So
not. Yes,
there are
so that is,
softwares available.
yes, softwares are available that we have been
Yes,
using, but
since long.
yes, how AI
Yes.
can further reduce the time and all, which can be like useful for us to develop the bioprocesses. So that is the purpose of this. I just
Yes.
want to hear from some of the experts here.
Okay. Okay. Exactly. That's for that reason I joined this. Ki other
Yeah.
than the software, what AI tools right now available doing these laborious tasks?
Yes, yes, yes.
Dr. Asha, you are from CSR laboratory, so you should only educate the audience.
So Dr. Prakash, basically
I know you
you
visited Mysore also during AMI conference.
I know.
Yes.
And the thing is, you know me. We have been working in this area for quite some time, and
Exactly.
but I thought I will get some education from this. But in our field, we can definitely have some discussion on this. But for AI, I would like to learn from others.
Yeah. So this is basically a learning platform only for every one of us.
Yes, yes.
Right. Because now the new generation can learn faster. Only the problem of manipulation and authentication is the challenge. And in our
See,
lab at
Dr.
CFT,
Prakash, what
yes.
I have realized from the generation who are using AI tools, they want to utilize the information the way
Ready,
they get.
ready-made.
Yes, ready-made.
Without
So
taking much trouble.
yes, and they think that whatever AI is telling is 100% correct. They don't want to use their brains to authenticate whatever is right or not. And I have seen this across all kind of masters, trainees and all. They come with the report generated from AI and they will put there, and by looking at the report itself we have to ask what you have contributed in this. You have not done anything on this. So that is how we should the AI platforms are to help us and reduce the time of the labor intensive works. So we should utilize our intelligence over artificial intelligence, and then we have to selectively use the information that we get out of that. So we need to train the students how to utilize the AI tools for their benefit.
Absolutely, you are very, very correct. That we should not use the ready-made information available as such.
Yeah.
But for that, actually, we have to use the human brain and then refine that, and then process and then see how best that collection of information can be presented.
Yes, yes.
In a more convincing way, in more distilled way. This is
Yeah.
what actually is required now. And then, as you said, this, especially the dissertation student, which of course I also have quite a good number.
Mm-hmm.
Suddenly they brings a very big report next day itself.
Yes, that is how. Yeah.
Which is not that easy or not possible.
Right.
And then we have actually now, beside the authentication or plagiarism check, even AI authentication
Exactly.
started in CFTRI.
Yes, yes.
Yes.
So it is mandatory for the PhD students now.
Yes.
Yeah.
You are very right. You are very right.
Yeah.
Now you are chief scientist since when, by the way?
Yeah.
Now you are chief scientist since when, I said?
Since okay.
Yes.
So since last year, 2025.
Yeah, because when you visited Mysore, you are senior principal scientist. I remember very well.
Mm-hmm.
Congratulations for the new promotion.
Yeah, thank you so much.
Dr. Brahma, are you there? I hope we are the topic.
Divyanshi Verma, Dr. Divya Tandon. Dr. Divya Tandon, Dr. Neena Mehta, Prasun sir has joined. Dr. Prasun Kumar, are you there, sir? Dr. Harsh Kalpana, Kabita Khobragare.
Yes, sir. Good evening. Good evening, everyone. It was nice discussion going on. I was just listening because I am not expert, neither I have used much tools. So I was just listening to the discussion.
Yeah, but please, you can also give your inputs, whatever the way you feel.
Yes, just it is my thought that to the question that Asa ma'am was asking, na, just my thought is about that is if we can get fermentation data. So every company is running fermentation, maybe brewery industry or even bioenergy or probiotic industry. So if you can get their data for continuous fermentation or for batch fermentation, and then we can analyze them to see the parameters in real time or
Sorry,
predict
sir. I'm Dr.
something.
Neena Mehta here. It was I was trying to unmute and suddenly disappeared. I don't know what to do. Sir, I'm Dr. Neena Mehta from Ryatbara University. It was like we have been working in different interdisciplinary research. So I have been working in PGI on tuberculosis and then microbial peptide antibiotics in my uh, research work, some work I did in Germany also, and in IMTech, Institute of Microbial Technology, biosurfactants and things like that. So AI for us. Hello.
Hello, madam.
Hello. Yeah, I think. Can you hear, sir?
Yes, yes, madam.
So what happened is that since now I'm into interdisciplinary research, and I just wanted to introduce Anshul to this because he is more keen to know about AI and microbiology, AI tools applicable in microbiology. He wanted to do some research on this antimicrobial resistance and MDR strains, and he has some experience also working on some isolates in the hospital. And because I am not much well versed, because we are all old age researchers, and we used to do again the way we were working manually for this digging out our articles, going to Delhi, going to different institutes and all that. So it was like Anshul, who has just joined in the Ryatbara University, and he was approaching me for guiding. So I just saw that this platform, because I'm part of member of MBSI, life member. So I thought I must introduce him. That is why I joined today for the purpose of making him aware of the new tools.
Good evening, ma'am.
Yeah.
Good evening, Nina madam.
Good evening, sir. Good evening, sir. So I also feel that we are a bit behind this, and all youngsters nowadays, they are looking for AI or um, chat GPT, and it is very difficult to guide these people, the young students, from this angle. They don't want to actually use their own creations. So that is where I am also finding a bit of difficulty in handling such students who are running for AI, but not for the purpose for which it should be used, but for the purposes where they don't have to put in their own creative ideas.
But in my opinion, madam, I think that now the creativity is how smart we are using the prompt. This is the only creativity, because you cannot stop now the students or research scholar to
Yes.
use it. But now there are the different AI tools for the writing means research, writing of the research articles also. But it
Yeah.
depends on what we are using the prompt. So
Yeah.
the creativity is now the prompting. Yes, sir. Thank you so much, madam, for joining.
Yes.
Prasun sir, you may continue. Prasun sir.
Yes, sir.
Yeah, you may continue now, sir. You were saying something.
Yes, I was just saying that if we can get fermentation data from the past 1 month or 2 months, if the system is continuous or continuously being operated for the same thing. So for parameters, if we can get on Excel sheet, because I have been to industrial R&D, so there the data gets generated in Excel, so real time data. Those if we can get, and then we can develop some kind of uh, tool to predict exactly what may happen if the parameter changes, or we can decide the time of harvesting based on AI. So we can develop the uh, machine learning models to predict the same and counter check the results with the same industry, whether the one was means successful and it gave some kind of achievable result or not. So that is just an idea. Maybe someone may be using actually the same thing. I'm not aware how to get this data because industry may not share it.
Yeah. Yeah, I think whatever
But those like Asha ma'am, yes,
sorry,
yes,
please
ma'am.
continue.
Like Asha ma'am, maybe in means working in collaboration with some industry, those who can share, and then it can be done or at least studied uh, based on the data.
So whatever
Hello.
data you get, but then you will have to authenticate with your at least representative experimental work, isn't it? Yeah. So even
Yes,
if
ma'am.
they look for a lot of data, international or WHO or whatever, but after all, few things they will have to do it in experimentally to authenticate, even if it is a computer generated or AI generated data. Am I right?
Yes. Yes, ma'am. For AMR, I have seen some of the paper that are using machine learning as well as AI tools. They are trying to develop to detect AMRs.
But I think that Madam has rightly said that ultimately you have to means go for the wet lab experiments. Then only you can confirm it. We can
Final
Yeah.
validation,
we
without
can
final
predict the
validation, we
pattern.
cannot
We can
conclude
predict that
anything.
what may be the genes present. So now the Asif Mulani, Asmita Bombole, Kriti Baghel, Shruti Badekar. So now we'd like to hear from you, sir. Prakash Salami, sir. Hello, are you there, sir?
Yeah, invariably dinner time, but just to
Yes,
put
sir.
what the
Just
other,
to put your concluding.
other expert, they told that how we can actually be careful, especially with this new younger generation, those who tries to use the AI ML for a shortcut approach, right? And then of course the data is actually quite big, large data. How effectively and efficiently we can analyze and then bring it to the actual conclusions. By finally, it is actually our human intervention which is actually required. Conventional microbiological tools we know it worked till 60s, 70s, or 80s. But then as soon as the molecular phylogeny came, then it was actually really advantage. But it doesn't tell that you depend only on molecular phylogeny and don't do the Burgess manual for systematic bacteriology, right? So similarly, this actually applies. You do AMR also through AIML, but then you, unless and otherwise you actually do the disk diffusion, disk assay or antibiogram, you will not know. Unless and otherwise you do the inducible or cross resistance, you will not know whether those such genes are really actually expressing, and are
Yeah.
not. If you do the sequencing also, you may find 100 genes, but which are the actually potential genes, and then they have the transferability or not, which is actually a major concern. We will not know unless we have the experimental data. And
Yes,
then
sir.
when even microarray started, very smartly people told that microarray few years it was okay, but afterwards it was actually the RT-PCR, which they told that target gene has to be evaluated by real-time PCR also, right? So we don't discourage the AI/ML followers at this stage. They can always use this technique or tool. When we also gave the our MSc dissertation thesis, so we got it printed. But now I don't think anyone has got it typed and printed outside, outsource. But now I don't think any students will do. They are doing on themselves because the availability of the tools, softwares, computers, and all. So similarly, I think AI, ML, and then microbiology also. We should not forget. Finally, also the microbiology, as rightly Dr. Ishika also told about the gram staining. So gram staining will remain. Gram positive will remain a gram positive and negative, and only few exceptions. Right. But now a lot of articles are coming up with reference to the fermentation, the phylogenetic analysis, drug discovery, AMR, different metabolites productions, product recovery, enzyme productions, where definitely this is the emerging tool. So we have to stretch our hand and try to learn some more additional information, and then see how best we can actually use, because yes, as the research is a global, right? And data is a vast. So analyzing in a shorter time, nothing should actually be left uncovered. Few years back when we were writing, this is a first report, and then comment comes, no, this is not a first report. Similar reports are there available. So either there was a mistake in our analysis, or we were actually overconfident to say, first report. But then there are actually the search engines which can actually tell the people also. We should know the subject science. Otherwise, it's not possible to find out, understand whether it is really a novel or new information or not, whether it is a first report or not, right? So from all this taken together, in advancement of a microbiology, AI, ML, because we have the large number of parameters, the data set, the diversity, new information, new public domains are getting enriched day by day, and I think as we have discussed this issue, this topic in the today's roundtable definitely gives a very inspiring and encouraging information. Maybe we should also continue in one or other different way, perhaps.
Yes, sir. And also we should invite a few experts. Then only.
Exactly. So here I will stop. As such, I don't have much information, or I was unable to collect much, because we have AML tool, especially in analyzing the data related to the cardiometabolic disorder. So that is totally the different aspect in CSR cohort project, right? Not from the microbiological perspective, but from the disease diagnosis, from for the health status perspective. We have such a information. Definitely, I think this today's roundtable discussion is very useful. Most of our MBSI members will make use of this opportunity.
Sure, sir.
And yes, and then they will also come the updated information, because I could see few of this actually participants told that they are already using few of the tools
Yes, sir.
in their R&D activity. So it's very inspiring information. And then we can actually ask them to enrich the knowledge in subsequent seminar also.
Yes,
We
sir.
can ask few more people, those who have some specialized information, to join, and then see how further we can actually improve. So definitely, I think today's all 30, initially 30 participants were there, 30, 35, now only 25, 24. They are definitely got benefited, I guess.
Yes,
So
sir.
those who could not join, I think they are the losers, in other words.
Good evening, sir.
Yes, please.
Sir, one question was there. Again, I would like to repeat it. Sir, for writing literature review, last how many years article should be studied, and how much, sir?
Anshu, this we can discuss later, because the thing is, what new you can learn from here, because that depends on how much, like what type of peptide or antibiotics you want to use. So ultimately, PhD may to you have to take from the beginning actually, but for collecting data, just like for the review purpose, उसमें मैटर करता है कि कितने साल का लेना है आपने, ठीक है? तो ये पॉइंट एआई के साथ डिस्कस करने के लिए अभी नॉट अ रेलेवेंट क्वेश्चन. सो आई थिंक यू बेटर आस्क सम अदर रेलेवेंट क्वेश्चन टू एआई एंड माइक्रोबायोलॉजी. वेयर इज योर डाउट?
मैम एआई तो मैम बहुत सारे हैं, और उनका कॉस्ट तो काफी हेवी है. तो सारे एआई तो हम लोग अफोर्ड नहीं कर सकते.
हाँ, तो उससे रिलेटेड अगर कोई डाउट है तो वो पूछो. कितने साल का डाटा लेना है, दैट कैन बी डिस्कस्ड लेटर, राइट? इट डिपेंड्स ऑन विच डायरेक्शन वी मूव.
अभी जो ऋषिका मैडम रिव्यू लिटरेचर के लिए ना, बहुत सारा जो एआई टूल्स है वो फ्रीली अवेलेबल है.
हाँ,
that can assist you. Okay.
I think you can make connection with Dr. Rishika, and she can maybe help you, because that is why we have come on this platform, that you can get yourself introduced to your field people, right? Researchers.
Okay, Ma'am, if she can share her contact number or any.
You may ask the request Rishika madam to share her mail ID here. Dr. Rishika madam, can you share your mail ID here?
Yes, sir. I am
Yes.
sharing it in chat box.
Okay, thank you so much.
Thank you. Thank you. So
Thank
what?
you, everyone.
Yeah, thank you. So what
Thank
specific
you.
tools you have to use? You can ask Dr. Rishika if she is already into this field of work, right? Thank you,
But
sir.
whatever tool we are using, AI tool, whatever we are using, that is for the authentication. You have to go through it. You have to cross check
Obviously.
it, whatever data it is being given you. And you cannot use the document as it is. Whatever AI
Obviously.
generated report is there, you cannot use it as it is. So be
Of course.
ethical in research.
Yeah,
Bottom line
of
is
course,
that
but
be
yeah.
ethical.
But the way which direction he is trying to go for research, so that a
Yes.
few things he wants to discuss, right? So
Yes,
other things,
for
of course,
data collection, citation methods, we can use AI for the laborious task. But for the intelligence point of view, we have to
yeah,
use our
yeah,
brains.
you have to put in your own brains. Yes, that
Yes,
is what
yes.
I am telling. Yeah,
Yes.
please. Thank you, sir. Thank you so much, Dr. Rishika.
Thank you so much, everyone, for
Thank you,
joining
ma'am.
today's session. Thank you, everyone.
Thank you.
Thank you, sir. Sir, feedback form, sir.
वो शेयर कर